Today we're going to talk about preparing for your initial home healthcare visit. There may come a time when a healthcare professional will need to come to your home. It is important to prepare your home for their visit to ensure your safety as well as theirs. This will also help make the most efficient use of your time for a quality visit with your home health provider. For starters, you will need a doctor's order to receive home health services. If you're unsure if you need a home health professional such as a nurse or a physical therapist to come to your home, here's a simple question to help you determine if you qualify. Are you homebound and only get out of the house for essential visits such as medical appointments, church, hair appointments, the occasional family gathering, or other necessary outings? If so, you may qualify for home health services which can include nursing, physical therapy, occupational therapy, speech therapy, and social work. You may also qualify for a temporary home health aid visit in addition to nursing and/or therapy. This will be explained to you if you qualify. This service helps with tasks such as bathing, mobility, transferring, or other non-medical amenities. If you are driving and getting around the community easily, or are currently on hospice service, then you may not qualify for home health care. And please note, you can only be involved with one home health agency at a time. Once it's determined you are going to have a home health provider come to your home, here are some things you should know. The initial at-home visit may take up to 2 hours. The reason the initial visit will take so long is because the medical professional will need to do a comprehensive head-to-toe assessment. Your home health provider will want to make sure how best to help you. After the initial assessment, your home health provider will attend to any medical issues you are having in coordination with your primary healthcare provider. The time needed for subsequent or follow-up visits will vary depending on the medical issues that need to be addressed. Some of the things you'll need to do to prepare for that first home health visit are: tell your home health care coordinator about any special circumstances about your home they may need to know before they get there, such as a hard-to-find address or parking issues, broken or unsafe steps or walkway leading up to your front door. Do they need a security code to get into a gate or front door of your building? For safety concerns, you will need to secure all pets and firearms. When possible, for your safety and the safety of clinicians, please have an area available for hand washing with liquid soap and paper towels. Have a clean, safe place for your home health provider to set up their equipment and store their belongings such as a computer or rolling bag. And keep walkways cleared of ice and snow or other debris. If you need to have someone with you during the visit, be sure to schedule with them ahead of time and make sure they arrive at your home before the home health provider. Please give reasonable notice to your home health provider if you need to cancel or reschedule your service. Your home health provider will also give you reasonable notice if they experience traffic, weather, or unforeseen issues that may delay their arrival or need to cancel or reschedule. During the visit, please have all your medicines handy in case you need to talk about them, including any over-the-counter medicines you may be using. It's helpful to have a list of all the things you want to talk about, such as any new issues you may be having or questions you need answered. Please refrain from smoking or drinking alcohol. Avoid using scented products such as perfume or cologne, and please don't burn scented candles or incense. And finally, minimize noise and distractions. For your safety, all members of your care team should wear a Providence identification badge that shows their name and picture. To support your safety, always ask to see a home health provider's identification before letting them into your home. If you are not sure of someone's identity, do not allow them to come into your home. Call us at the number provided by your home health clinician to confirm their identity. Members of your care team practice hand hygiene and may wear protective equipment such as gloves, mask, face shield, goggles, gown. These are to protect you and the community. If your provider wears protective equipment, some of it will be left behind for you to dispose of in the regular trash bin to prevent the spread of infection. Our care coordinators and home health providers may need your medical information. Please have that at the ready. However, Providence home health providers will never ask about your personal financial information. We do not need any information about your bank accounts, credit cards, PIN numbers, or your debit cards. Please don't share this information. If a provider asks about this information, report this to your home health coordinator. We hope you found this helpful and are now prepared for your initial home health visit. And, as always, please be good to yourself and each other.